Hello, gentlemen. I'm a urologist practicing in the United States. For more than 20 years, I've had a habit. Before any exam, I ask my patients over 60 a very simple question. Do you still feel you deserve the gentleness of your own body? Some smile, others grow quiet. At this age, we've all fought our private wars, surgeries, medications, losses, but the need to touch ourselves, gently, safely, respectfully, never disappears. It just changes shape. I want to say this to you the way a son would speak to his father. Masturbation after 60 is nothing to be ashamed of. Done properly, it can improve circulation, deepen sleep, lower stress, and even support prostate health. But like climbing an old staircase, you need to change your pace and how you place your foot, or you'll slip. The male body changes with age. The skin is thinner, the nerves are sensitive in a slower way, and the prostate needs more time to recover. And just a few small mistakes, gripping too hard, using positions that compress the pelvic floor, rushing to the finish, skipping lubricant, or overdoing the frequency, can turn something beneficial into a spark for pain, numbness, inflammation, even loss of sensation. In today's video, I'll talk to you like I would to old friends. How to masturbate safely after 60, the common mistakes to avoid, a simple framework I call CAE, cleanliness and comfort, appropriate technique, respect, timing and recovery, and evaluate constantly, as well as the warning signs that mean you should see a doctor right away. I'll draw on clinical knowledge about the aging male body and on what I've learned from thousands of real-life visits. This isn't a medical speech. It's an honest conversation between men who've lived through many seasons. If you're watching in a quiet home somewhere in America, maybe on a Sunday afternoon, please treat the next 15 minutes as a small practice of gentleness toward yourself. And one quick note, this video is educational and not a personal diagnosis. If you have heart disease, diabetes, or take medications that affect erections, always speak directly with your treating physician. Mistake number 1, not using lubricant. Many of you tell me, Doc, I never needed lube my whole life. I hear you. But the body after 60 isn't the body at 30. Penile skin is thinner, oil glands are less active, and nerves respond more slowly. When you masturbate dry, friction climbs sharply. Tiny micro tears, too small to see, become a gateway for inflammation, burning, and even scarring that slowly dulls sensation over the years. I once saw Mr. Harold, 71, from Ohio, who came in with a pinprick burn after every session. He thought it was a complicated infection. In fact, it was prolonged friction on thin skin. 3 weeks after switching to a water-based lubricant and slowing his pace, the burning disappeared and his sleep improved. Lubrication isn't a luxury item. It's more like motor oil for an engine that served you faithfully for decades. A thin, correct layer reduces friction, protects the tiny blood vessels under the skin, and gives your nervous system time to sync with pleasure without needing a crushing grip. Sensory science shows that with gentle, even stimulation, nerve receptors respond more steadily. Your brain registers pleasure more clearly, with less rushing and fewer aches afterward. In other words, a drop of gentleness can change the quality of the entire experience. I recommend water-based, unscented, pH-neutral products. In the US, you'll find them easily at places like CVS, Walgreens, or your local supermarket. If you tend to get jock itch or irritation, look for labels that say glycerin-free or for sensitive skin. Skip warming, tingling, or menthol products. They stimulate with chemicals that can scramble the pain-pleasure signal and are more likely to burn aging skin. If you use condoms, avoid mineral oils or petroleum jelly. They can damage latex. Using silicone toys, avoid silicone-based lubes to protect the toy's surface. Water-based is still the safest bet. How you use it matters as much as using it. Don't squeeze out a single drop and hope for magic. Make it a small care ritual. Wash warm, clean gently, then apply about a nickel-sized amount to your palm. Rub your hands to bring it to body temperature, then touch slowly. After 3 to 5 minutes, if things feel dry, add a little more. Don't use saliva. It evaporates quickly and its enzymes can irritate. When you're done, rinse with warm water. Let the skin air dry or pat gently, then wear breathable underwear. Some ask, will lube make me dependent? No, it simply lets natural processes unfold in a way that respects age. Gentle doesn't make you weak. It allows better blood flow, keeps nerve endings from being ambushed by pain, and lets your body enjoy without paying for it the next morning. If, despite a suitable gel, you still feel burning, redness, swelling, or notice unusual discharge, that's a signal to be examined. Sometimes it's a mild allergy and you just need a different product. Sometimes it's dermatitis or balanitis that needs treatment. I always tell my patients, at this age, the best pleasure isn't the fastest. It's the safe, smooth, and steady kind. The right lube, an unhurried pace, and a deep breath. Those 3 small pieces help you keep living kindly with your own body. This video is educational. If you have conditions like diabetes, chronic dry skin, or you're on medications that dry the skin, talk with your physician about choosing the right product. Mistake number 2, staying in a position that compresses the perineum too long. For men over 60, I often hear, lying face down and rubbing on the mattress gets me there faster, or I sit on the edge of a hard chair and lean in. That area between the scrotum and the anus is the perineum, a delicate crossroads where blood vessels, nerves, and the pelvic floor muscles meet. When you press on it for too long, the pudendal nerve can feel like it's trapped in a tight tunnel. At first there's tingling, then sharp, burning discomfort. A few days later, you might notice burning with urination, pelvic heaviness, even a flare of prostatitis-like symptoms. Many men mistake this for a urinary infection and jump on antibiotics, but the root problem is posture. I remember Miguel, 72, from Texas. He was used to lying face down and grinding to get it over with. Afterward, he'd have burning when he peed and a dragging heaviness in the groin. His tests showed no infection, just prolonged pressure on the perineum and bladder neck. We made a deal. No more prone position. Use a U-shaped cushion with a front cutout, sit back in a supportive chair, place a pillow behind the knees to open the hips. Every 7-8 minutes change position and practice slow belly breathing at 4 to 6 breaths per minute. 2 weeks later he called, "Doc, it feels completely different, lighter and smoother." Physiologically, this is straightforward. The pelvic floor, the muscle sling that supports the prostate, rectum, and bladder, likes a gentle open-close rhythm. Continuous compression traps blood, causes microscopic swelling, and activates pain receptors. The brain starts mixing pleasure signals with danger signals. In older adults, blood vessels are touchier and recovery takes longer. That's why after a night of over-pressing, the body can feel like it did a bad gym workout the next morning. So how do you stay safe and still enjoy yourself? First, change the pressure surface. Avoid lying face down or sitting on hard edges. In bed, lie on your back with the upper body slightly elevated by pillows. Place a small pillow under the knees so the hips relax. If seated, pick a chair with a wide, soft cushion. Add a U-shaped cushion or split groove cushion. Avoid closed donut rings. They shift pressure to the rim and still compress the center. For many men, standing or a half-kneeling position supported by the bed works well. Gravity distributes load and the perineum can breathe. Second, don't stay in any one position longer than 10 minutes. Pause, release, change the hip angle, or roll to your side. Think of it like switching legs on an old staircase. You change sides to rest, not to drag things out. During those short breaks, let the pelvic floor drop. Inhale and let the belly rise. Imagine the spot between the scrotum and anus settling downward a little. Exhale slowly and keep that softness. This is relaxing, not squeezing, not Kegels. Third, catch early signals. Tingling, prickly heat, the sense of sitting on a pebble, pain radiating to the scrotum or penis. These are cues to change position right away. If after finishing you have pain lasting more than 30 minutes, bluish discoloration, coldness, or burning urination for days, that's not something to tough out. Get checked. Men with a history of sciatica, lumbar spine arthritis, diabetes, or long hours on narrow bicycle saddles should be extra careful. All these make nerves more irritable. Finally, try a simple post-session recovery ritual. Rest a moment, then get up and walk gently for 3 to 5 minutes around the house. Drink a warm glass of water and apply warm compresses to the lower abdomen or perineum for about 10 minutes. These small habits improve blood flow, let the pelvic floor let go, and teach your body that pleasure comes with safety. We don't need to push harder. We need to be smarter and kinder to that small bridge called the perineum, the one that has quietly carried us through a lifetime of being men. Mistake number 3, gripping too hard. Many men tell me, I'm not as sensitive as I used to be, so I have to squeeze hard to feel anything. I get it, but that harder to be safe approach is exactly what traps the body. After 60, the skin is thinner. The tiny vessels under it are more fragile, and the nerve endings, especially the dorsal nerve of the penis, need a little warm-up time before they deliver full sensation. If you clamp down from the start, the pressure causes microscopic bruising in the soft tissue and drowns out pleasure signals with a quiet kind of pain. Over time, the brain learns that only very strong, very narrow stimulation is worth responding to, while everyday touch, gentler and with a broader contact, goes silent. You might joke that your hand has trained you too hard. In medicine, we call this pressure-based sensitization. I think of Alan, 69, from Virginia. He used a twist-the-cap grip, tight squeeze with a wrist twist, finished in a few minutes, then had pins and needles for 30-40 minutes, and weaker erections the next day. We didn't start with pills. I asked him to change his hand's language. Treat it like a massage, not a twist. Begin with very light contact, like applying lotion. Count 6 slow breaths, about 60-90 seconds, so the nervous system can tune in. Only when you feel warmth, heaviness, and a stronger pulse at the base should you increase pressure one small notch, no more. 3 weeks later, he told me, I'm not numb anymore, and the sensation feels richer. Physiologically, this makes sense. The touch and pressure receptors on the glands and shaft prefer broad, even stimulation. High squeezing force creates a narrow band of pressure, cuts down capillary flow, and briefly starves tissue of blood. The brain flags potential danger and raises the sensation threshold. We think we need more force to feel, but really, we've trained the threshold upward with poor technique. When you switch to a wider contact surface, using the whole palm, supporting underneath as if holding something delicate, blood flow opens up and the nerves start speaking in a gentler, clearer voice. Here's a practice you can try tonight. Warm your hands and apply a water-based lube. Shape your hand like a cradle. Don't lock the thumb and index finger into a tight ring. Let them act as a soft gate, with the other fingers supporting below. Glide with the skin of the palm, not a pinching fingertip grip. Keep a steady, moderate rhythm tied to your breath. Inhale 4 seconds, exhale 6 seconds. If you catch yourself tightening, pause 10 to 15 seconds. Relax your shoulders, jaw, and pelvic floor. Imagine the spot between the scrotum and anus softening. Then continue. Don't chase the peak by white-knuckle squeezing. Let your breathing set the pace. Afterward, listen to your body. If tingling lasts more than 30 minutes, the skin changes color, or the next day your erection quality is noticeably lower, rest 48 to 72 hours to fully recover. If you have diabetes, peripheral neuropathy, or take medications that affect blood vessels, the rule of light, broad, even matters even more. And if you've trained a hard grip for years, don't get discouraged. The brain can retrain. Give it a few weeks of disciplined gentleness, and natural sensation returns, not as a blinding flash, but as a warm, steady wave. The kind of pleasure you can carry with you into a deeper night's sleep. Mistake number 4, using constriction. Rings DIY devices unsafely. I meet many gentlemen who tell me, I just want to keep my erection better, so I used a ring. The problem isn't the ring itself. It's how you choose it, how you use it, and how long you keep it on. After 60, blood vessels injure more easily, skin is thinner, and nerves are sensitive in a different way. A ring that's too tight, or a homemade device like a rubber band, cable tie, or a solid metal ring without a quick release can turn a few minutes of fun into an emergency. Swelling, bruising, cold numbness, even a ring that gets stuck. In medicine, we call this penile strangulation from a constriction ring. I remember Mr. Thomas, 66, from Oregon. He used a metal ring to be safe, then kept it on longer than planned because he fell asleep. When he woke, his penis was dark purple and cold. Embarrassed, he tried to soap it off. His swelling only got worse. His family finally brought him to the ER, where doctors used specialized tools to remove it. Thankfully, the tissue hadn't died. From that day on, he told me, "Doc, I only use quick-release rings, and I set a timer." Here's the single most important point. A ring should assist, not control. If you choose to use one, pick medical-grade silicone with a wide band or a ring with a quick-release clasp. Avoid all DIY materials, solid metal rings, zip ties, or wires. Once you swell, they won't loosen. What size is right? When worn at the base of the penis, don't include the scrotum unless you're experienced, you should still be able to slip one finger between the ring and the skin when flaccid. That's your safety breathing room. Before putting it on, apply a thin layer of water-based lubricant to the skin and the inner edge of the ring. After removal, clean up and watch skin color for 5-10 minutes. Time discipline is life-saving. Limit to 20-30 minutes per session, never wear during sleep, and don't wear one when intoxicated. You'll miss pain signals. While using it, if you feel sharp pain, pins and needles, coldness, purple, blue discoloration, or shiny tight skin, take it off immediately. Never try to push through to finish. That's a sign of ischemia, poor blood flow. If the ring gets stuck, do not use pliers, a saw, or a knife at home. The risk of cutting nerves and vessels is huge. Go to the emergency department. They have the proper cutting tools, pain control, and sterile technique. Some ask, "I have medical conditions. Can I still use one?" If you have diabetes, peripheral vascular disease, bleeding disorders, are on anticoagulants, warfarin, apixaban, etc., have peripheral neuropathy, or have had prostate surgery, talk with your physician first. These increase the risk of bruising, hematoma, numbness, or slow healing. Using a ring along with PDE5 inhibitors, erection pills, isn't always prohibited, but you must be extra strict about time limits and watch your skin closely. A safe, simple 5-step ritual. Prepare. Warm room, soft light, wash hands. Choose a quick-release ring and a water-based lube. Lubricate. Apply a thin layer to the base of the penis and the inner edge of the ring. Put on and check. Put it on before full erection. Make sure you can slip one finger between ring and skin. Time limit? Set a 20-minute timer. When it rings, remove the ring and rest 10 to 15 minutes to restore circulation. Evaluate. Check skin color, temperature, and sensation. If numbness, pain lasts 30 minutes, or swelling doesn't go down, get medical care. And one more reminder, don't get creative with DIY gear. Things that look harmless can trap your own blood like a gate slamming shut with no key. We don't need to challenge the body. We need to be kind to it. The right ring, used the right way, plus a small timer. That's the thin line between safe pleasure and a night in the ER. Mistake number 5, masturbating too often. There's a gentleman in Minnesota, James, 67, a retired mail carrier, who told me, "I do it every day to fall asleep, but lately I wake up heavy, I'm peeing in little spurts, and by afternoon I've got no interest left." His story isn't unusual. After 60, the body still desires, but the rhythm changes. Recovery after ejaculation takes longer, the pelvic floor tires more easily, and the prostate needs time to clear microinflammation and replenish fluid. When we ask the body too often, polite signals, fatigue, tingling, heaviness, start knocking at the door. Physiologically, the refractory period lengthens with age. Completely normal. The nervous system and blood vessels need extra time to reset. Neural firing settles, the pelvic floor softens, blood flow evens out, and prostatic fluid is restored. If we keep stimulating before those processes finish, the body answers with pelvic floor soreness, brief burning with urination, groin heaviness, and a drop in erection quality the next day. In some men, especially those with a history of prostatitis or BPH, a high frequency can flare symptoms: more nighttime urination, mild burning after ejaculation, or that lingering heaviness in the perineum. I'm not saying frequent is wrong for everyone. I'm talking about the cost of a dense rhythm at our age. Many men tell me the more often they do it, the harder it is to get aroused, and the more they want to try again to fix it. That's a tiring cycle. When they pull back to once every 48 to 72 hours, a lot of men report better daytime energy, deeper sleep, and the return of morning erections. Quality over quantity. That's the body's mature philosophy. I gave James a simple ritual. First, change the goal. Don't count how many times per week. Ask, does my body feel ready today? Relaxed shoulders, decent sleep the night before, no groin heaviness, a calm mind. Second, change the pace. Instead of sprinting every night, give 15-20 unrushed minutes for body and mind to downshift. Warm shower, a few belly breaths to relax the pelvic floor, water-based lube, then slow technique with a broad, gentle hand, just as we've discussed. Third, change the schedule. If you finished last night, let the body rest today until natural desire returns. 3 weeks later, James messaged me. I no longer feel tired, but doing it anyway. Each time feels more complete. Common signs you're overdoing it are very everyday. Morning grogginess, fewer morning erections, tingling at the glands lasting more than 30 minutes afterward, frequent urination, perineal restlessness, or a dip in mood. Those are polite knocks. Back off for 3-5 days. Favour light walks, warm water, solid sleep, and a warm compress over the lower abdomen. If symptoms don't ease, or you notice pain, fever, clear burning with urination, or unusual discharge, see your doctor. For men on erection meds, heart medications, or with diabetes, the 48 to 72 hour guideline deserves extra respect. Not a rigid rule, but a safe cadence for vascular and nerve recovery. Men often ask, so what's the ideal frequency? I usually smile. The ideal frequency is the one that lets you wake up proud of last night. No burning, no fatigue, no emptiness. For many, twice a week is great. For others, once every 3-4 days. Let genuine desire speak, not habit or the fear of losing your edge. One last thought. Our bodies have never needed disciplined gentleness more than they do now. When you give it time, it gives back warm, smooth, steady pleasure. Not loud, but deep, like the soft creak of a wooden house on a quiet American evening. Slow down, gentlemen. Slow is how we go far. The CAE method. Safe masturbation after 60C, cleanliness and comfort. I always begin with a small ritual. Wash your hands with warm water, dry them with a soft towel, trim nails if needed. It's not just to avoid scratches. The warmth cues your nervous system that you're about to spend a few respectful minutes with yourself. Choose a quiet spot in your American home, a bedroom, an armchair by the window, or a bathroom with a soft rug. Keep a clean towel and a bottle of water-based lube within reach. Your body opens up more easily when you're comfortable. Pillows supporting your back, hips relaxed, and a seat soft enough not to compress the perineum. Treat those few minutes of setup like warming a teapot. Rushing spoils the brew. A. Appropriate technique. Rub a thin layer of water-based lubricant into your palms. Warm it with your hands, then make contact lightly and broadly. Don't lock the thumb and index finger into a tight ring right away. Think massage, not twist and squeeze. I often coach patients to sync with breathing. Inhale 4 seconds, exhale 6 seconds, letting the hand follow the breath instead of racing ahead of desire. When your body signals with warmth, gentle heaviness, and a stronger pulse at the base, increase pressure one small notch. That's enough. Switch hands and angles every few minutes to avoid imprinting one narrow style that later requires excessive force. If you're used to lying face down on the mattress, switch to lying on your back with pillows or standing lightly supported by the bed. Your perineum needs to breathe. And remember, if you feel yourself getting impatient, pause 10 to 15 seconds, relax shoulders, jaw, belly, then continue. Lasting pleasure comes from moderation, not speed. Respect timing and recovery. At this age, the body prefers a slower rhythm with rest built in. Instead of finish fast, allow at least 15-20 unrushed minutes, not to force a long session, but to give your nervous system time to warm up. When you finish, don't spring up. Lie still for a minute, hand on your belly, breathe slowly so the pelvic floor softens. Then walk around the house for 3 to 5 minutes, drink a warm glass of water, and consider a warm compress over the lower abdomen or between the scrotum and anus for 5 to 10 minutes. Just as important, rest 48 to 72 hours before the next session. It isn't a rigid rule, but a safe cadence for blood vessels, nerves, and the prostate to reset. Many men tell me that when they honor this interval, morning erections return. That's your body saying, thank you. Evaluate constantly. Listen to your body like you would to an old friend. Do you have pain, numbness, or burning that lasts more than 30 minutes? Any color changes, swelling, coldness? Afterwards, any burning with urination, frequent trips to the bathroom, or perineal heaviness? If so, lighten pressure, change position, use more lube, and space sessions out by 3 to 5 days. You can keep a simple short journal. What position today? How long? How your body felt the next day. A few lines are enough to reveal your personal pattern. And if you notice bleeding, bluish discoloration, unusual discharge, or pain that doesn't ease, don't tough it out. See a doctor. An early appointment is always cheaper than a night in the ER. CRE isn't a strict rule book. It's 4 reminders to treat the body that's carried you for decades with respect. Be clean and warm. Touch correctly. Honor rhythm. Keep listening. Practice this way, pleasure stops being a strength test and becomes a quiet moment of peace. A small, beautiful part of life for an American man in his 60s. Dear gentlemen, the message I want to leave you with is simple. At any age, our bodies deserve disciplined gentleness. After 60, physiology changes not to punish us, but to remind us to change our tempo. When we use lubricant properly, avoid compressing the perineum, let go of the iron grip, steer clear of DIY constriction rings, and respect a 48 to 72 hour recovery window, the result isn't just safer pleasure. It's mere peace of mind. Waking up tomorrow feeling light and proud of last night. I've walked alongside many American men in their 60s. Veterans, mechanics, teachers, long-haul drivers, each with his own story, all sharing the same worry. Am I still normal? My answer is always the same. Yes. Normal is listening to your body and adjusting. Don't hesitate to talk with your doctor, even about topics that feel delicate. An early appointment is always worth more than a night in the ER. If you have persistent pain, bluish swelling, numb burning that doesn't fade, and bleeding, unusual discharge, burning urination, or new erectile difficulties, please get checked. We don't have to suffer in silence. If you're feeling well today, think of B, say, and pa as 4 tent pegs in your own backyard. Clean and warm, right touch, honor the rhythm, keep listening. Give yourself 15, 20 unrushed minutes. Breathe slowly and let your hands speak a new language. Light, broad, even. Practiced this way, sex isn't just a finish line. It becomes a quiet moment of peace. Like a soft breeze under the porch on a calm evening, wherever in America you happen to live. Thank you for staying with me to the end. If this video helped, share it with a peer. Sometimes an honest conversation between men is the best medicine. And if you'd like, I'll make deeper dives next time. How to relax the pelvic floor, how to choose lubricants for sensitive skin, and the warning signs that mean it's time to see a doctor. Wishing you a peaceful night. Be kind to your body. It's been with you a long time. See you in the next video.